know from our time working together that promoting health equity, especially among historically underserved populations, is a core goal for MassHealth. What does health equity look like to you, and how do you know when you're making progress?
The most straightforward answer here is that we'll monitor the data that we're collecting while at the same time working to improve our data collection capabilities. And if we see a reduction in disparities, then we'll know that we're making progress. But it goes beyond that approach, right? So, for example, we know from the literature that there are specific areas or populations where disparities are often observed. Even if we at MassHealth have challenges in seeing those disparities in their full view because of incomplete data collection. But we don't want to wait until our data become perfect before starting to act. And so we'll know we're making progress when we're already implementing policy changes or requesting authority from CMS to do so. So a couple of things just come to mind here. So one thing that we've done that we have already kicked off is we're providing housing supports and nutrition supports to certain ACO members through our flexible services program. And we know that so often there are disparities in the kinds of folks who have these health-related social needs when compared to a white reference population, as an example. And then in terms of that bucket of things of where we're requesting authority from CMS to make some policy changes, well, as part of our next 1115 waiver proposal, we're requesting authority to try to improve or to reduce some of the disparities for the maternal health population. So we want to extend postpartum eligibility to 12 months. And really the thinking behind this is we know that maternal morbidity and mortality rates between Black and white women is different, right? And if we can extend that eligibility to 12 months, there will be greater health coverage, which will hopefully help to reduce some of those disparities. And then one other population that we are focusing on in our next waiver is the justice-involved population. And we want to implement 12-month continuous eligibility for justice-involved individuals upon release from incarceration.